We have, in addition to usually about 35 to 45 different strains of cannabis flower on our menu each day, an equal number of concentrates and edibles. So we generally have about 100 different selections. We also have a lot of unique forms of cannabis. So we have capsules, we have sublingual sprays, we have topical ointments that you can just put onto your skin. So that's one of the benefits, I think, for patients is that they have access to the different forms of cannabis. So, for example, we might have a patient who comes to us who's suffering from chronic pain and insomnia, and they can't get a good night's sleep. Well, for a patient like that, you would not want to recommend an inhaled form of cannabis because an inhaled form of cannabis only lasts 60, 90, 120 minutes. You would want to recommend an edible form of cannabis to them, a capsule perhaps, which would have an effective period of 6 to 8 hours and allow them to get a full night's sleep. On the other hand, if you had a patient who woke up in the morning with uncontrollable nausea, who needed to go to work in 90 minutes, the last thing that you would want to do is try to have them swallow a capsule because they might not be able to do it anyhow. And even if they did and it was effective, they would be blitzed for the next 8 hours while they were at work. Not very effective. So instead, what we would recommend is that the patient would use a sublingual spray. The sublingual spray will take almost immediate effect within 5 or 10 minutes. It will give them relief from the nausea, but the psychoactivity will start to wear off in about 90 minutes. In other words, by the time they get to work, their nausea will probably be under control and they would be ready for a full day of productive work. So we train our staff to have a dialogue with patients, to ask patients questions in order to elicit from them how they would be using the medicine so that we can make a recommendation of the very best type for their purpose. In California, the one form of cannabis that is not legal for medical cannabis patients is extracts such as the Rick Simpson oil. And I've found it very difficult to find any source for it. Certainly if people brought us the Rick Simpson oil, we would happily stock it, but we don't have it. And under California law, like I said, it's not clear that it's legal for medical cannabis patients to produce those types of extracts. I very much hope that the Tax and Regulate initiative wins. I have my doubts about whether that's actually going to happen or not. I hope that it does. In my view, rather than moving our debate immediately to full legalization of cannabis, I think that the most important thing for our movement to do at this time is focus on creating positive models of cannabis distribution. If you take a look at public opinion polls in the United States, very consistently you see that 70% of Americans support medical cannabis or decriminalized cannabis, but when you ask them the question about legalized cannabis, that level of support drops down into the 42, 44, 46 percentile. What explains that? Because you have people 25 or 35% of people who are simultaneously saying that they're okay with medical cannabis, but they're opposed to legalized cannabis. Why? Why is that group of people only halfway there? Well, I've had a lot of opportunity to talk to law enforcement officials, homeowners groups, reporters, government officials, lots of different types of people about medical cannabis over the course of the last 4 years. And what I've learned is that these people have a lot of fears about legalization because any model that they conjure in their head of what legalized cannabis would look like is scary to them. Some of them, more than you would expect, think that legal cannabis means that the Mexican cartels are going to open up on the corner of suburban subdivisions and start slinging weed to school children on the way to school. Other people who are more sophisticated are concerned that it would end up in the 7-Elevens and that their kids are going to not only have to walk past the alcohol and the tobacco, but also past the weed when they go to the 7-Eleven, or that they're going to pick up the latest issue of Vibe or Rolling Stone and see a 2-page glossy spread for reefers in the style of Anheuser-Busch. People are concerned, and I think rightfully so, about the idea of a cannabis company that would be spending 20 times as much money on creating a market, on advertising, as it would be on producing the product. So what I feel is that we really need to address these fears, that before we can persuade that 25 or 30% of swing voters to embrace cannabis, we need to show them a system for distributing cannabis that is safe, seemly, and responsible, that doesn't scare them, that doesn't make them afraid for their children or for their communities. And the way to do that, I believe, is creating more positive examples like Harborside Health Center. And my wish is that the movement would focus on engaging with municipalities and state governments and urging them to write regulations that allow the creation of a positive, nonprofit community service model of cannabis distribution like we've pioneered here at Harborside Health Center. If the movement listens to these words, fast forward 5, 6, 7 years, what will we have? We will have hundreds or thousands of positive models of cannabis distribution in states all across the country. People will have seen that the cannabis is not in the 7-Elevens, it's not on the corner of their subdivisions, it's not being foisted on their children. They will see that tax revenues are being produced that are helping out their community, and they'll see that this has all been done in a good and responsible way. It's at that point that we go to the people and we make the argument for a science-based cannabis policy. And what does a science-based cannabis policy tell us? It tells us that cannabis is safer than most of the substances that are sold in pharmacies every day without a prescription or without a recommendation. Aspirin kills hundreds of people every year in this country. Cannabis has never killed anybody. So what we would like to see is when that time comes and we can make that argument to the American people, that we just switch from a propaganda and emotion-based policy to a science-based policy. What would that mean? That would mean that at the doors of the dispensaries, instead of taking recommendations for medical cannabis, we would just check and make sure that people were adult Americans. We would flip the switch at the dispensary door and allow all Americans the same access that medical patients in California have now. Well, you know, Harborside Health Center is really dedicated to helping our patients grow their own cannabis. One of the services that we have is a Grow Your Own Medicine seminar every Sunday, which lasts most of the day. And at different times of the day, different levels of expertise are discussed in the seminar. In addition to the Grow Your Own Medicine seminar, we have a very large selection of clones and really the best selection of seeds in North America today, at least in the United States of America. I don't know the exact number, but dozens and dozens of seed varieties, and typically I think 20 to 40 different varieties of clones on any given day that we sell here. And so we encourage patients to learn how to grow their own medicine and hopefully grow a little bit more than they need so that we can supply it to other patients who are unable to grow their own.
And they're of course bringing out different clones that you can buy here at the dispensary. And of course you can see how happy everybody is to bring these nice cuttings out. Look how beautiful these are. Absolutely ready to rock and roll. Good roots, good looks. Look at nice fat roots on there. Yes, ready to go. And that variety is
Bubba Kush.
Bubba Kush. And as I'm stepping back, let me kind of pan here. Look at how many varieties of clones that they're offering to patients here. Look at this. This is remarkable. They have 3 people helping. That's how busy they are with their clones. And everything under the sun. And what are the prices for these things per clone?
These here are 12 plus tax.
12 plus tax.
$13.17 out the door.
$13.17 out the door per cut.
Certainly. Ones that are a little bit further along are 16 plus tax.
And that would be like
The
these.
top 2 shelves on the far right.
Okay. Yeah. So it's,
On the bottom shelf, there are some $36 cuts, mostly of blue-green, and those are a bit further along than the previous ones.
look at this. $36, and you could shock your husband or your wife or your boyfriend or your girlfriend with an absolutely wonderful Valentine's gift. Look at all these. Now, couldn't you imagine just taking these home putting them in your backyard next to your tomatoes and making all of your neighbors